My name is Jordan Solis. I'm a professor and chair of communication studies here at UNL and a faculty member with MHDI. I want to thank you, everyone, for joining us today for the Minority Health Disparities Initiative Grand Rounds. And before I introduce today's speaker, just some real quick housekeeping. Chat is disabled, but we do invite you to use the Q&A to put any questions you have throughout the presentation day. And at the end of the presentation, we'll go through and address as many of those as we can. So I am incredibly honored today to introduce our presenter, Dr. Deadric Williams. As many of you know, Dr. Williams spent a great deal of time at UNL, both as a graduate student and a faculty member, before moving on to his current institution. And I actually first met Dr. Williams when colleagues kept referring me to a brilliant doctoral student who may be able to assist me with some complex statistical analysis. Over the years, Dr. Williams' research writing has been influential in my own work, and his mentorship has actually been crucial to the success and impact of some of my previous doctoral students. So this is a great opportunity and privilege for me. Dr. Williams is currently an associate professor of sociology at the University of Tennessee, Knoxville. Dr. Williams, much of what you'll learn about today, his research centers on the intersections of structural inequality, families, and health. His research has been published in top disciplinary and interdisciplinary journals, and further, his scholarship and writings have been influential on how scholars and students are thinking about and conceptualizing race and racialization as we address social inequities. In 2022, he was selected as one of 5 William T. Grant Scholars nationwide, which is a program to support scholars to improve the lives of young people in the United States. He is the director of the Center for the Study of Family Health and Well-Being at his institution, which is an interdisciplinary initiative aimed at understanding how societal structures impact families and children across the U.S. When Dr. Williams is not producing scholarship and giving talks to various academic and non-academic organizations across the country, he's actually well known in the Knoxville area and in social media for his incredibly well-manicured lawns. So. We are extremely fortunate to have Dr. Williams join us today. And so without further ado, I will turn over to him and his talk, Systemic Racism and the 3 M's of Racial Inequality and Implications for Health Disparities. And thank you for joining us today.
Wow. Thank Dr. Solis for that kind introduction. I appreciate all of your words and your friendship and kindness while I was a graduate student, a postdoc, and an assistant professor at Nebraska. Your kindness and support is not lost on me. So I appreciate you for all what you have done in terms of helping me in my career. I also would like to thank Minority Health Disparities Initiative Grand Rounds for inviting me, especially to Alexis and Holly for the communication that they have, the several emails that we have been engaged in to make sure this is a success. So I appreciate both of you. A special shout out to the Department of Sociology, where I received my PhD in 2014. Wow, I can't actually believe it's been that long ago. And also I am talking to the screen and can't see people. So this is always awkward in this space. So I will do my best to make sure that the presentation is as enlightening and as charismatic and as fun as I would be if I were in your presence. Also, I can't not talk about the fact that Nebraska holds a special place in my heart, in so much as I, again, spent 4 years in the PhD program in sociology, 2 years in MHDI, actually, as a postdoc, and then a assistant tenure track professor in the department for 3.5 years. In 2019, I made my departure and now at the University of Tennessee. And I appreciate the faculty who are in the department who was there when I was a graduate student. Those who are still there, I appreciate all of you. Also, if there are people on this call who are not academics, whether family and friends, who clicked on the link and registered to be here, I appreciate you all as well. And just as a kind of broader context here, this talk is really a charge to health researchers who do quantitative research. And to be quite frankly, those of us who do racial inequality research in general, regardless of the outcome of interest. So this talk is really trying to do two things. I'm going to critique our kind of our conventional ways of thinking about racial inequality research from using quant methods. And then I am going to present a path forward um, to really nail down what Dr. Salih said in the beginning, our understanding of racial inequality, especially from the context of racialization, and offer what that means. So before I even begin the talk, I want to make sure that you and I are on the same page in terms of the phrases and terms that I'm going to be using throughout. So first of all, race is not some shorthand um, thing for a shorthand word that means the minorities or the blacks or some ahistorical demographic group or groups. When I talk about race, I'm talking about a relationship, and I'm going to unpack these throughout the presentation. And second, you will hear me say people racialized as black or people racialized as white because I care about the social construction of race, the racialization process. I do that because it's easier for me to say that and mean what I say than saying black people and white people as if those particular groups are ontologically real. This presentation will focus on black-white inequality. And I've started to put this in my presentations because normally when I give a 45 to 60-minute talk, there tends to be someone in the audience that will ask me something about a particular group that my research do not cover. There are some really dope scholars, for example, who does work on Latinx populations in health. I do not do that work. And so when people ask me about other social constructed groups, I often don't respond, largely because I don't want to talk about a particular topic that I am not trained in. I am sensitive to the work that other scholars are doing. I just don't do that work. And also, as the title states, that I'm be talking about systemic racism. And what I mean by that is an ongoing, this ever-changing system of ideologies and structures that does three things. These ideologies and structures make the ideal of race possible. They disproportionately advantage the dominant group and disproportionately disadvantage the subordinate group. If I'm going to use terms like the preservation of whiteness, that's simply the ideologies and structures that favor people racialized as white, and structural anti-Blackness is the ideologies and structures that disadvantage people who are racialized as Black. Last, I want to make a statement that there's usually this assumption that racism means some intentional act. Like, for example, the idea that there's some egregious, deliberate act that one race does against another race. That's not racism. Racism is a system. And I'm going to be talking about that throughout the presentation. But what often happens among folk who don't have a, a full understanding of racism, the assumption is racism has to be an intentional act. And intentionality is not a necessary condition for anti-Black racism and the preservation of whiteness. It's sufficient, but not necessary. Also, before I begin the full talk, I really want to explain why I do this work. This has become increasingly important for me to deliver to my audiences so they can get a glimpse of why I write the kind of work and do the kind of work that I do. So first, my work wants to acknowledge and challenge this notion of epistemic violence, which simply means a form of harm exerted against and through knowledge. Specifically, Eurocentric knowledge that's often framed as universal with the faulty notion of being inherently rigorous and objective. My larger point is that social science research has naturalized or naturalizes epistemic violence by interpreting the nature of racism and race, by misinterpreting the nature of racism and race, and thus legitimizing what I refer to as conventional racial inequality research. So on the one side, I want to acknowledge the taking for granted ideas that often permeates social science research that's taken for granted. And what I am arguing is that that particular type of conventional research does more harm than good. But on the other hand, I want to create a path moving forward that highlights epistemic justice, that is, providing fairness and equity in the production, recognition, and valuation of knowledge. So, who can be a knower and who can't be a knower, for lack of words? Also, what knowledge is presented to graduate students via syllabus or syllabi, and whose particular framework is often charted as good or presented as universal, and what particular perspectives are rendered invisible. In much of my work, I'm challenging Eurocentric knowledge as universal by centering historical context, such as settler colonialism as it relates to the United States. Also, work by others that deals with the fungibility of Blackness. I'm not going to be talking about settler colonialism and the fungibility of Blackness in this particular work, but I want the audience to understand that that line of research kind of grounds or anchors the work that I do. So back to the the presentation title and presentation page, and what I'm going to do is walk us through the critiques I am bringing to the table, but also a path forward. So most of the audience know or should know that Black-white health disparities is an issue in the United States. And what you see on your screen are adult health disparities between people racialized as Black and white, and also children who are racialized as Black relative to children who are racialized as white. Children who are racialized as Black compared to children racialized as white. And what you see is a host of health inequities that this particular group, a racialized group, experience. And I'm not going to spend too much time on this. I just want to highlight that health disparities, Black-white health disparities, is a social fact. And although most reasonable people would not debate whether or not Black-white health disparities exist, the debate often arrives about answering the question, why? So if one is to understand that Black-white racial inequality is a fact, when people start to have a conversation about why does Black-white inequality exist and persist, debates often occur as a response to this question. And what I want to do is bring those particular conversations to the table, and I've framed them as conventional racial inequality research versus critical racial inequality research. I want to also highlight that theoretical perspectives, the lens through which we see the world, for those of us who wear glasses, that metaphor works for the lens through which we see the world, but those lenses often comes with a set of taken for granted assumptions, and I want to lay those particular assumptions to bear as I go through this particular presentation. So first, if we take this particular road that's on your screen and we veer off to the left to the conventional racial inequality research, what particular perspectives and assumptions do we see as it relates to this line of research? So first, there is this assumption that racial groups are taken for granted as demographic groups. Race is often seen as a predictive variable or a risk factor to hypothesize that differences will exist. Most research papers are often state something like, on average, Black Americans will have poor health compared to white Americans. But we're assuming that race itself is the cause of the particular outcome. Second, that race is often disconnected from racism theoretically, and racism often shows up as a residual in statistical analysis as some unexplained variance that may be happening in the background. Second, there tends to be a focus on attributes what I refer to as human capital that are often used as explanations for why racial differences exist. And I put racial differences in quotes largely because I want to highlight the idea of racial differences is problematic within itself. So the assumption of why scholars use this approach is that it often comes with this ideal of Eurocentric universalisms. That is, if the measures or these human capital attributes like marriage, income, employment, if they are beneficial for people racialized as white, then they must be universally right as a way to reduce inequality. The second assumption under this particular attribute argument is that an attribute or sets of attributes can create parity between groups. This is what I refer to as the backdoor deficit framing. While front door deficit framing makes the argument that there's something about people racialized as Black themselves that create the inequality. In this way, it's not about, for example, people racialized as Black committing more crime. We use a variable like incarceration to test whether variation in incarceration explains variation in health. And if race is seen as a cause, we get to the assumption 1A, it could be assumed that if people racialized as Black don't get incarcerated, they'll have better health. And it's much more nuanced than that. Lastly, there's an idea of analytic bifurcation. And Julian Gold refers to this in his work. And what this is really getting at is that analytic bifurcation via quantitative methods is the slicing or dividing of relations into categorical essences that are not real essences. So what this simply means is that the idea of those who are racialized as Black or white are real, are ontologically real essences. And we're trying to divide these essences to understand inequality. So data analysis, by treating racial groups as real essences and monolithic, can reveal why racial differences the third 3B assumes that people who are racialized as white are the standard against which people racialized as Black should be measured. So, as an example, a conventional research question often starts with, what accounts for Black-white inequality? And this question, I argue, is inherently problematic because it's often tied to the statistics that we're using to answer the question rather than the theoretical mechanisms that make the inequality possible. So even the very questions we ask from a conventional research perspective is inextricably linked to the tools we're using rather than the theoretical real reality of the people that we're exploring. And so for many of us, we move from that question, what accounts for the Black-white inequality gap, and we have usually present a conceptual model that looks something like this on my screen. Now, most of us who have taken research methods or an introduction to stats course, or specifically social statistics, have seen this conceptual model, where we start with some kind of race variable and some kind of outcome of interest. And we recognize that there's disparities, there are disparities by race in some outcome. And our goal is to look for mediating mechanisms that quote unquote account for that particular gap in that outcome. So what ends up happening is that our analyses are often look something like this. I hope that the Scooby-Doo reference still align with people. I hope I haven't aged myself too much here. So what ends up happening is that many researchers are looking for these mediating variables such as family formations, right? Education, neighborhood disadvantage, unemployment, or some type of attribute, because again, the attribute is often assumed to account for the racial gap. But what critical scholars are saying is that the creation of race, the variation in your y variable, your outcome, and the variation in some mediating factor are all endogenous to a larger system of racism that makes all of that possible. So the approach is inherently problematic, largely because the ideal of race is divorced from the ideal of racism. And so studies open up with this idea that there's a racial gap in health, and then there's mechanisms that we want to test that work as mediating factors to account for that gap. In almost every study I read, we get to the end after the scholar has entered their favorite variables, and it's often states something like, well, the variables used in this particular manuscript doesn't fully account for the racial gap in our outcome of interest. So what must it be? It's racism. So racism is often left to the end of studies as some residual in our quant methods, or the lack of theorizing at the beginning of the study that renders racism invisible. And to render racism, or to disconnect racism from race, is akin to saying that one likes the H2 part of water, but not the O part. They are inextricably linked. So, what must we do to move forward? And the central argument I'm making here is that race is not a predictor or risk factor to hypothesize that something, some adverse outcome, will happen. Instead, race is the outcome that tells us that racism as a system and as processes has already happened. So, with that in mind, I am going to encourage you to take this particular route to the right side of your screen to understand what are the theoretical perspectives and assumptions linked with a critical understanding of racial inequality research. So first, we make the argument that racism as ideologies and structures is an ongoing feature of the United States. We assume that racism is a system that makes the ideal of race possible. So to study racial inequality in the absence of racism theory using quantitative methods, I make an argument is that simply white supremacy wrapped in a statistical package. Second, racial groups were created to standardize pre-existing inequality to justify the domination and oppression that was already happening via power relations. So racial categories are ad hoc inventions to overlay on pre-existing inequality to justify things like land theft, genocide, chattel slavery, etc. And from this approach, we assume that race is a socio-historical and political classification system, not a predictor or risk factor. And lastly, racial inequality should be studied using a racialization approach. That simply means that racism operates as a process that gives racial meaning via social interactions, things like prejudice and discrimination. Here, race becomes a verb and produces this idea of quote unquote doing race. Not only is someone being a group, not only is a group being raced, but other groups are doing the racing. And I'll unpack that later on in the presentation. So the work that I've been doing since I've left the University of Nebraska, it started with my 2019 piece, is what I published before I actually left University of Nebraska. A call to focus on racial domination and oppression was a response piece to a conventional racial inequality demography paper in which I'm pushing back against not only that scholar, but how the field set up our modeling strategies And I'm critiquing the way the field set up their modeling strategies and the atheoretical understanding of racial inequality. So that professor wrote a piece. I was able to respond to the piece on the far left-hand side. And then that scholar was able to reply to my response. And one of the things that that scholar said in the response or the reply was that my argument was based in ideology and not testable theory. And as most ambitious assistant professors are, I wanted to move forward and challenge that notion of ideology versus testable theory. Now, as an aside, all of us are working under the auspices of ideological. We can't divorce ourselves from the society in which we live. But we can pay attention to history and the historical processes that make things like race salient in our lives. So with that said, I wrote a book chapter in Introduction to Africana Demography entitled Rethinking Black Families in Poverty, Post-Colonial Critiques and Critical Race Possibilities. And the conceptual model you're going to see in a few, the initial iteration of that conceptual model is in this chapter. And then I co-authored a piece in Social Problems to use things like critical race theory and quant crit to test against these demographic arguments, such as family structure as a quote unquote cause of poverty, and wanted to test that demographic perspective against a critical race perspective to demonstrate that even under the so-called best conditions, women, mothers who are racialized as white are still less likely to be poor relative to mothers who are racialized as Black and Latinx. But I didn't stop there. Someone who, and I'm going to give a shout out to sociology again, a highly quantitative department. In the last 3 to 4 years, I've been writing theory papers. It's a kind of irony somewhat. And so racism and the mechanisms maintaining racial stratification in Black families is another iteration to the book chapter in Africana Demography of really highlighting that conceptual model that I'm going to present here in a bit. Secondly, the middle paper, Racial Disparities Without Racism, what I'm doing here is having a conversation with family sociologists and demographers, and that there is a tendency to highlight Black pain, Black death, Black suffering, but racism as a system is often rendered invisible as a cause of Black death, Black pain, and Black suffering. And we need to account for racism as a system and processes so the disparities are not a byproduct, are not interpreted as a byproduct of racial categories themselves. And lastly, a paper in JML, Journal of Marriage and Family, what is quant crit doing in a nice field like family science? And I'm really calling family scholars out on the carpet, so to speak, to really do a better job of thinking about the theories we use and the analysis that we do to understand racial inequality in family life. Now, that work has produced the work that you're hearing about today. And my work today really builds on Bonilla Silva's racialized social systems theoretical idea. And what he argues is that societies in which economic, political, social, and ideological levels are partially structured by the placement of actors in racial categories or races. He further argues that racism should be studied from the viewpoint of racialization. I contend that after a society becomes racialized, racialization develops a life of its own. I build on this framework by asking a simple question. If racialization develops a life of its own, then what maintains this life? What nutrients, metaphorically speaking, is providing sustenance to the life of racialization? And my argument is that the preservation of white racial exclusivity, along with Black racial exclusion, creates a particular system where many people are invested in the benefit of a hierarchical system. Now, the challenge here is that it does in the post civil rights era, in our contemporary era, one does not have to be intentional. These particular systems have already been happening before any of us were born. What's happened is that white racial exclusivity and black racial exclusion has become naturalized in such a way that many Americans have taken it for granted. So, building on this argument, I argue that once racial categories are legalized and normalized, they set in motion a mutually sustaining process of structural anti-Blackness and the preservation of whiteness that operate as these interlocking gears to maintain inequality. The reason in the beginning of this talk that I stated that race is not shorthand for the minorities or the blacks is that race represents a relationship. So, in order for the preservation of whiteness to exist, it necessarily needs structural anti-Blackness to function. Now, one would also have to also argue that structural indigenous inequality, anti-immigration laws, etc., all serve the purpose of preserving whiteness as a particular idea where ideologies and structures disproportionately benefit those who are racialized as white. I further argue that there are four mechanisms, and I'm going to give a descriptive of these particular mechanisms because they serve as the metaphorical lubricant that ensures that these mutual sustaining gears continue to spin. And these mechanisms include ideological behavior racism, the minimization of racism, state practice structural racism, and the notion of racialized space. Again, my goal is to highlight the theoretical apparatus that I'm using for my work. And I'm going to present these particular mechanisms, how I'm measuring these mechanisms, and I'm going to display some descriptive about these particular mechanisms. I'm not going to go into depth into any analyses for several reasons, but the key reason is that this is a book project that I'm halfway done, I'm more than halfway done, and some things I just want to keep close to the vest at this particular moment. So, what does a critical conceptual model look like, especially in relation to the conventional conceptual model of racial inequality research? So, I'm going to present this on the screen, and I know that it is a lot to take in. So, I'm going to get a drink of water. And the way that you read this is from left to right, but from top to bottom. So, the making of racial inequality, the mechanisms maintaining racial inequality, and the manifestation of racial inequality are the three M's that it's a byproduct of systemic racism. So, the making of racial inequality presents racism as a system. Racism has two components: ideologies and structures. And these ideologies and structures are often working together to create the illusion that race is ontologically real. So the system creates race. But the ideologies and structures actually serves as the context for interactive processes whereby racism becomes a process of racialization. And then lastly, the manifestation of racial inequality highlights racism as differential experiences. So again, the reason that I problematize the ideal of racial differences, because it runs the risk of reducing race as if it's ontologically real. The inequality that we see in the population is a byproduct of differential experiences that ends up legitimizing race as if it's ontologically real. And I'm not going to leave you hanging on this conceptual model. I am going to go through it piece by piece. So first, when we think of the making of racial inequality, that ideologies and structures create this notion of race, how does that happen? Well, I'm glad you asked that question. To start, again, my work is builds on settler colonialism and the fungibility of Blackness, but because of time constraints, I'm going to start with recognizing guys like Linnaeus and Blumenbach, who created these kind of four groups to denote humans were the assumption that humans are of different species, right? And they not only characterized the groups, but they gave them value labels. And unsurprisingly, the people of European descent had all the good attributes, whereas people from of African descent had negative attributes. And just as an aside, so Linnaeus is operating in 1758. By 1775, Blumenbach comes on the scene. In 1795, he updates this and adds the word what we refer to as Caucasian, which is also a problematic term that is often used to describe people racialized as white, but it has these kind of racist origins that we have to be careful with when talking about people in these particular types of categories. Now, again, what I want to point out is the years in which these scholars are writing. It's before America declared independence in 1776. Because by 1783, we get the America gained actual independence with the Treaty of Paris. And then we get the Constitutional Convention of 1787, where we get things like the Three-Fifth Compromise, the Electoral College, the slave trade extension, the fugitive slave cause, and the idea there will be no interference with slavery. Here, the making of the Constitution creates a context where human beings are constitutionally subjugated and bound to subjugation. Those of us who study American racism have to put this in context, because here the idea that people racialized as Black are not human beings is part of the American imagination. It is literally the thread that holds the metaphorical the thread that stitched the American fabric together. So it is important to when we talk about racial inequality, that we recognize the genesis of racial inequality. So 3 years later, after we have the Constitutional Convention, there is the Naturalization Law of 1790, where we get the idea of free whites and citizenship, that one's citizenship is an exclusive club, that the existence of the category, remember that inequality is already happening. Genocide, land theft, chattel slavery is already happening and been happening. This process not only legalized this idea we call race, but normalized it in such a way. And in 1790, we get the first US Census, where we have racial categories, and those racial categories don't exist by happenstance. The placement of racial categories in the US Census becomes a mechanism to carry out the Three-Fifths Compromise. So again, what is important here is that the invention of racial categorization is an ad hoc invention to justify brutality, dehumanization, because a country that says it wants freedom, liberty, and justice had to justify why they can treat other people less than human. So again, racial categorization are ad hoc inventions overlaid on pre-existing conditions in the term of genocide and chattel slavery. So race is a classification system that reflects a relational hierarchy, not simply a nominal variable. So those who are racialized as white, and this particular exclusivity, I recognize that it changes over time, depends on one's European ethnic background, also gendered processes. I recognize that, so I want to make that clear. But when we talk about the idea of race, particularly the social, historical, and political construction of whiteness, its existence serves the purpose of exclusivity, while those who are not racialized as white are part of systematic exclusion. So once these particular groups become normalized and legalized, it sets in motion these relational processes where beliefs about inequality, for example, if people of African descent are non-human, that gives way to racial prejudice via dehumanization. Dehumanization allows people to be prejudicial, and that prejudicial seems normal. On the other hand, there are structures, laws, policies, and social practices that gives rights and benefits to the exclusive club while render exclusion to the racialized other as a byproduct of racial discrimination via undeservedness. Who deserves to be free and who does not? And these relational processes change over time, and they serve the purpose of reinforcing race as if race is ontologically real. So how does these particular processes change over time? It's a second really good question. To understand this, let's take a short kind of journey through three particular eras in American history: the slavery era, Jim Crow, and the kind of our contemporary neoliberal idea. So racism is composed of two components. You have the ideological component at the top of your screen and the structures at the bottom. The black arrow pointing down, the dominant group represents the dominant group that imposes their will on society in the notion of power, right? The ability to influence others even if against their own will, kind of a varying context here. And then the up arrow is the subordinate group fighting against that oppressive regime to activate social change as a form of social movement. So I'm going to walk us through, as the particular eras change, so will the ideologies and structures, and the racialization process that's a byproduct of the human relationships or the human interaction that the dominant group and the subordinate group are having between one another. So if we start with the idea of slavery, the slavery era, where ideologies were often rooted in biological superiority and inferiority. And the structure was chattel slavery itself. But because people racialized as Black are not simply passive recipients of an oppressive regime, they are active participants in fighting against those oppressive regimes. That works as the general strike thesis. If you read Du Bois's Black Reconstruction, he makes an argument that enslaved persons freed themselves, in which they escaped slavery to the North, where the Emancipation Proclamation is a wartime executive order being freed, not because of some benevolence, but rather because the president at the time saw an opportunity to win the Civil War. And so when we get to the Civil War, the North wins the war. And then we move to what we call the Reconstruction era. But by the time we reach 1876, is a contested presidential election. 1877, we get the Great Compromise of 1877, where one Rutherford B. Hayes becomes president of the United States via a gentleman's handshake of sorts. And his presidency only happened through the removing of the federal troops from the South. So this is what I refer to as both political parties providing a proverbial up yours to people racialized as Black, because once the federal troops leave the South, we get the rise of Black codes and Jim Crow laws that brings in another particular era where new ideologies that shift from biological superiority to cultural superiority and segregation, and Jim Crow laws are the structures that govern these racialized relationships. This is a continual part of racialization. And of course, we all know the civil rights movement happens in the 50s and 60s, challenging Jim Crow, often leading to civil rights legislation. But when we get to the late 70s and 80s, we get the rise of this notion of colorblind or color evasive racism, where racism is not a thing anymore. And then we have structures such as laws that represents the war on poverty, crime, drugs, that we all know disproportionately disadvantage people racialized as Black. So we go from in-your-face or overt forms of racism and slavery and Jim Crow to these covert forms of American racism, where the assumption is that racism is no longer a feature of the United States. And of course, we have the Black Lives Matter movement in protest against things like the killing of people racialized as Black by law enforcement. So not only do we have racism as a system that makes the ideal of race possible, racism as processes that sets the stage for racialization via relational processes such as dehumanization and undeservedness, it inherently produces differential experiences that shows up as racial disparities or inequality in the population that gives rise to the assumption that racial groups are legitimate essences that exist as real things. So again, racism makes the ideal of race possible. So when we get to this particular road again, the extent to which we use a particular perspective to guide our research, the critical question that I ask in my work and to the audience, where do we start? Do we start from the ideal of racial differences that runs the risk of reinforces the idea that race is ontologically real? Or do we start with racism as a system and as processes that shape differential experiences that produces the inequality and would subsequently create the illusion that race is ontologically real? Where we start in our research shapes what questions we ask, what data, how we analyze data, how we talk about our results, and what conclusions we draw from those particular findings. So, given this ongoing history of racism, then what are some ways that scholars can use racism to theorize Black-white inequality? That's the third great question you have asked so far. And make an argument that we need to focus on mechanisms that maintain Black-white inequality. The question is framed this way because it's not like these socially constructed racial groups were equal and then became unequal. The inequality is why we have the racial categories to begin with. So the mechanisms that we are interested in should always be thought of as a way to maintain something that's already happening. Doing that well requires us to conceptualize our mechanisms via racialization. And this is where the next few slides, I'm going to introduce you to a set of mechanisms that I care about in the work that I am doing. But these are not the only mechanisms. I can't write about all the mechanisms, but my encouragement is that when scholars have mechanisms that they want to use to explore of whether it accounts or maintains Black-white inequality, one of the things we must do is conceptualize that mechanism, not just in terms of variance. Well, there's variance on some measure like marriage or education, but rather that mechanism should be conceptualized in terms of racialization. And I'm gonna walk us through what that means and how to do it as well as we can. So it's the same conceptual model, but in the middle of those mechanisms, I highlight four mechanisms in particular. And these mechanisms, again, are reinforcing the idea that race is ontologically real. And they serve as the racialization process. And and again, they are ideological behavior racism, the minimization of racism, state practice structural racism, and racialized space. So here's a kind of description of each mechanism, its component, how it relates to the component of racism, and how it relates to the relational process or racialization. So, for example, ideological behavior racism refers to the belief that attribute racial inequality primary to the behaviors and presumed cultural failings of Black Americans themselves. This is an ideological feature of racism, and the relational process it serves is racial prejudice via dehumanization. That is, there's something about quote unquote those people is why inequality exists. And I'm going to walk us through each one of these in terms of their description. So I'm not going to read it all on this one slide, but I just wanted to give you an idea that these mechanisms represent a unique component of racism, but also serves a relational process as well. So in these mechanisms, I want to, for descriptive purposes, I wanted to contextualize them as it relates to the states in the United States by asking a simple question. What is the spatial distribution of these four mechanisms across the United States? And theoretically, I can't be a good social scientist without telling you why I'm using the state as a context. I'm gonna go through this briefly because this is not the main feature of the presentation, but I want you to know that state context matters because we have a racialized history in the United States, states that supported slavery, Jim Crow laws, the Great Migration, of people racialized as Black leaving the South for northern cities. We get the rise of segregation in northern cities. Also, the increased power that states have through federalism, right? The devolution at the federal level, preemption at the local level, states preemption from the local level that influences state power and control. We know empirically that racial ideologies are linked to policy preferences. That is, studies that demonstrate that when people, particularly those who are racialized as white, have particular preferences towards laws that they see as they have lower preferences if they believe that a policy will help people racialized as Black. Growing work from Tyson Brown and colleagues about state level structural racism and racial disparities in health. And we know that states legislators disproportionately reflect people who are racialized as white. So when we took mechanism one, ideological behavior racism, as I read you the description earlier, the ideal is these cultural failings of Black Americans themselves. It could be family life, criminal, being inherently criminal, lazy, etc. And what I do with this particular measure or mechanism, I should say, is that I'm recasting Matthew Hunt's work at ASR that uses the GSS data. He referred to these as structural mechanisms, but I am recasting them as ideological behavior racism because they're getting at something more than just quote unquote structure. So I use the GSS for this measure using the restricted data that has state level data in it. The discrimination in education measure is recoded to no, whereas less inborn ability to learn is yes, and lack of motivation and willpower is also yes. And what I'm doing is I want to show you a description at the state level to give you a sense of variation of these mechanisms across the US. So first, I mapped the ideological behavior ideological behavior racism across the US. And for the sake of time, I'm only going to highlight the quintile 5 and 4. And this, I I frame it as quintiles. The darker the shade is high levels of ideological behavior racism, and the lighter shades are lower level of ideological behavior racism. And what we see on your screen is the states in the South and in the Midwest have higher ideological behavior racism as it relates to this, but again, as it relates to this measure. I want to just highlight where these measures are kind of quote unquote glowing at, because I think that matters in terms of studying inequality. Um, for those who use statistics as a tool to understand health disparities, it shouldn't be surprising given the history of people racialized as Black in the South, given that particular history, right? But also, I want to highlight your Midwestern states as well, your Illinois, Indiana, Missouri, Ohio, Pennsylvania, and Virginia, largely because there's often taken for granted premises when talking about ideological behavior racism as if it's reserved to people racialized as white in the South. And of note, these are only the white respondents, or the respondents who are racialized as white in these data. Second, the minimization of racism refers to the belief that racism is no longer a significant or systemic force in the United States. Prior research shows that the minimalization of racism is associated with anti-Black prejudice. And the measures used for this is from the Cooperative Congressional Election Survey from 2010 to 2024. Racial problems in the US are rare, isolated situations from strongly agree to strongly disagree. Those are reverse coded. And the second is white people in the United States have certain advantages because of the color of their skin. I've combined these to create a scale for these just to identify where would these map in terms of the United States. And here we see something very similar to the previous measure, is that the South have many of southern states have high scores. But you also see places like Idaho, Wyoming, South Dakota, North Dakota, Missouri, Arizona, that also have in the quintile 4 also have higher scores as well. And the purpose of doing these particular maps is just to see where how variable these measures are across the United States. And the third measure, the state practice structural racism, I make a different argument than my colleagues who study state level structural racism. What I argue is that states function to do a set of things. And that's 5 things I've identified that states do. They educate the population, they employ the population, they have elections, so the population gets to vote. They have social safety nets, such as welfare, and then they incarcerate the population, right? And what I want to demonstrate, I'm going to go through this really quickly here. These are the measures and the indicators of it, the source of where I'm grabbing these data from. There's long time periods, but I'm capturing it in the aggregate right now for simplicity reasons. And we can, if anyone have questions about these, we can address it in the Q&A. So what you see on your screen now is Black-white inequality. And each measure is framed around Black-white inequality. So the schools measures, for example, is that students racialized as Black are more likely to be in disadvantaged schools, predominantly Black schools, low-income schools, et cetera, relative to students racialized as white. Full-time employment means people racialized as Black are less likely to have full-time employment. The voting is people racialized as Black less likely or not have the states with small populations of citizens racialized as Black voting relative to white citizens. Welfare transfer means that people racialized as Black are less likely to receive welfare benefits relative to their white counterparts. And the incarceration is people racialized as Black are more likely to being incarcerated than people racialized as white. And what I'm, again, demonstrating here is the distribution of where these particular types of inequities exist. Again, inequality, racial inequality specifically, is often highlighted in Southern. The assumption is that the South is where the inequality experienced by people racialized as Black exist. And what these particular maps show that is not always the case. So things like school inequality, we do see Southern states, including my home state of Mississippi and my current state, Tennessee, but you also have Midwestern states as well, from Wisconsin, Michigan, Illinois, Ohio, Pennsylvania, New York, New Jersey, Maryland, and DC. Full-time employment, you see the West is kind of clustered. The states are over in the West. Voting is sporadic. Also, there's missing data because of the number of people racialized as Black in those states as it relates to voting. A welfare transfer is not unique to the South as well. And then incarceration, this maps on to other previous work of how Midwestern states and Northern states have high levels of Black-white incarceration. So again, I just want to kind of whet your intellectual appetite to demonstrate that high scores mean more inequality for people racialized as Black than the lighter scores. And the last one, racialized spaces. I've been writing on this for quite some time, and this refers to the process by which physical locations and geographic boundaries are imbued with racial meaning, reinforcing social hierarchies through the built environment. And what I make, and other scholars as well who does work on race and space, is that space itself becomes a race-making process. Although many social scientists have studied things like neighborhood disadvantage or predominantly Black neighborhoods, what's often missing from this line of work is how predominantly white spaces actually also work as a race-making process. Is just often taken for granted. And to capture racialized space, I use the isolation index that measures the degree to which people inhabit geographical units inhabited primarily by members of their own group. And here's the white isolation index. This is for people racialized as Black relative to being isolated relative to people racialized as Black. And again, we see, and again, this particular measure in particular is not new. Those of us who are familiar with racial residential segregation indices know that isolation index is one. I'm recasting segregation measures in a way that tries to capture a set of racialized processes. I am less concerned about the distances between racialized groups, and I'm more concerned with how particular spaces, and to be more explicit, predominantly white spaces create and maintain racial inequality. And you see a clustering of high scores in the South, the Midwest, and also the lower Northeast. And I think that's also important to consider when thinking about racial inequality. So, given these particular examples of using these measures at the state level to show the distribution across states, what I want to highlight is that the variations we see may be a byproduct of the history of the United States, right? So racial ideologies in Southern states, we had slavery, Jim Crow laws, lynchings, etc. So the interpretation of racism and race from people racialized as Black, among people racialized as white, about people racialized as Black is telling, right? So the idea that racism is no longer a thing, or that inequality is a byproduct to people racialized as Black own selves, is important because we know that that's also related to policy support or non-support. Structural racism in Midwestern and Northeastern states, We see resource hoarding, redlining, and racial covenants, the history of those particular things there. And what I want to capture here is that specific mechanisms may be more important than others relative to the state's history and contemporary context. So moving forward, I'm working on a series of projects that looks at stability and change across each of the mechanisms, additional years for the state practice structural racism measures. I'm also including a kind of late Latinx white inequality measures for the state practice measure, and also using these measures to test specific outcomes like poverty, health, and other forms of well-being. And so I argue in closing that this work has several implications, moving away from the oversimplified statement that race is a social construction towards asking race was socially constructed for whom and for what purpose. We need to start centering racism and not race. We need to focus on structural inequality by looking at the causes of the causes. So it's not just about racial variation in a mediating mechanism or any mechanism, but what are the causes for that variation to exist in the first place? And linking historical with the contemporary, both theoretically and analytically when possible, work on redlining and lynching, and also historical racial regimes, demonstrate the value of connecting the historical with the contemporary. And interventions include anti-racist training, moving beyond basic cultural competence to actually understanding anti-racism and what that means, especially since racism is often taken for granted as a system. Our education, we need to move beyond one's academic discipline, decenter Eurocentric thought, and learn the history of racism as a system, not racism as an individual level egregious act. And community-based care, there are scholars who are in barbershops and in churches that implement health screenings and management programs to foster better health. And I'm gonna close with a quote that is really near and dear to my heart, is that history without sociology has no fruit, and sociology without history has no root. And I ask the question again, which path are you following as it relates to racial inequality research? Thank you.